Good afternoon. We're back in session. And to begin our afternoon session, I turn to the Healthy Responsible Students team led by Mr. Reginald Keenan. Mr. Keenan.
Thank you, Mr. Chair. I'm Reginald Keenan along with my good friend Alan Duncan, the chair of the HRS committee. And Mr. Chair, today on the new business, we have two items in action. We have one item, but first of all, we have Dr. Esset, who will talk about the overview of work related to the whole school, whole community, whole child model. And at this time, I'll ask, oh, you're already there, thank you. Proceed on, please.
Good morning. Thank you, Mr. Keenan, and good morning, Chair Davis, Superintendent Truitt, and board members. It's good to be with you to share some information that we have to bring forward with you about some of the non-academic concerns of our students in public school. So today, everything we do, Maria, will be in the context of the whole school, whole community, whole child framework. We'll talk about the Healthy Active Children Policy Report data. We'll also give you an update on the Youth Risk Behavior Survey data that we have in for this year. And then we'll talk about some of the policies and programs that we're working on to address some of those needs. And then finally, Anson County Schools is with us today, and they'll share some of the work they are doing around the whole school, whole community, whole child framework. So the Healthy Active Children Policy Report, you have the entire report in front of you. It is a PowerPoint presentation. I'm going to hit the highlights of things that may have changed a little since last year so that we can get into some deeper data discussions as we move forward. Just a reminder that the Healthy Active Children Policy has 8 components. That number one being a very important one, that every LEA is required to have a school health advisory council. Some of the highlights from this year's report. 100% of our LEAs responded, 115 out of 115, with just a little coercion. 43% of the school health advisory councils met at least quarterly, and I'll talk about that in a second. 70% of our school health advisory councils provide annual reports to their boards of education, and then 65%, I think, provided staff wellness programs. So looking at how our school health advisory councils have met, if you see in 2019 we started to see a drop off. That was around March, I think, that COVID hit and our folks didn't meet as often. Didn't meet much during 2020. Most of our school health advisory councils were doing a lot of work in their communities, and then they moved up and we're meeting more and more, and in 2022 43% met at least quarterly, and we expect that to continue going up. The number of LEAs providing staff wellness programs, and we've gotten a lot of requests for support around staff wellness, and we're trying to work on that. 49 of our LEAs say that all of their schools get staff wellness programs, and 21 of our LEAs say that at least half of them are getting that. So our districts see that as an important component of the work for our schools. So the Healthy Active Children Policy requires that all K through 8 students get 30 minutes of physical activity daily. At the elementary level, 97% of our LEAs say that all of their students get that primarily through recess and some through physical education. At the middle school level, 77% of our LEAs say that all their students get 30 minutes of physical activity, mostly through physical education, and since PE is not offered every single day, some of them aren't getting it all through physical education, so they do classroom energizers to help get more of that physical activity. The policy also requires that no LEAs withhold recess as a form of punishment or to make up lost work. And 97% of our LEAs say that they're not withholding recess. We want that to be 100, since the policy says they shouldn't be doing that, but we'll continue working, and that's going up steadily each year. We also ask, where do you need help? And you can see employee wellness was the number one request for help from us this year, and we're working on some resources to try to support our LEAs more with employee wellness efforts. And then finally, we ask LEAs, what did you do well? What were your successes this year? And a lot of those came out of COVID. So just some of the themes that came: nutrition. There's a lot of great work that happened around nutrition during COVID, and many of our schools kept doing it. They said, if it worked during COVID, it can work out of COVID too, so they continued some of that work. The mental health needs, that keeps coming back. I'm going to show you some more data about that in a minute. Telehealth. I think Anson County will talk a little bit about telehealth later. A lot of folks really started relying on telehealth to meet the needs of students who weren't able to be in person with. Some of our districts use some of their COVID dollars to add specialized instructional support personnel. What we were really proud of were the community partnerships. If you can remember that model, the outside of it is the community, and everything we do should be focused on how it fits within the community in which our schools sit. And there are a lot of community partnerships that started during COVID and have been sustained since then, so very excited about that. School safety. Many of our districts got school safety grants, and they've been using that to help make their physical building more safe, as well as providing mental and emotional health supports for their students. And then finally, many of our shacks were engaged with some of the COVID funding around testing and vaccinations programs, and they still are working in that. So happy to see those successes for our schools. Again, because we know that those healthy children learn better. So all of the data that I just presented was what we're doing for our students in schools. The next set of data that I'll present to you is, what are our students saying? What are they saying about themselves? This is Youth Risk Behavior Survey data, just a little history. We've done this survey since 1993 on odd number years. We survey middle and high school students about a range of behaviors, including unintentional injury, tobacco, alcohol, other drugs, sexual health, obesity, physical activity, nutrition, so a wide range of questions that they have to answer. And this is their opportunity to tell us, what are we doing? And the data that I'm going to show today will be 10 years. So we'll start with 2011 and give you a 10-year span between 2011 and 2021, which is the data I'm presenting today. So I'll start with the good news. Some things got better. If you look at smoking, the bottom line, the yellow line, is cigarette smoking, and that has continued to go down among our students over time. The top line is vaping, and we started asking this question in 2015. That's why the line starts there. Seen some increases, but in 2021 we saw a decrease in vaping as well, so very excited about seeing that start to come down. We also asked students about drinking alcohol, and that has consistently gone down since 2011. Fewer and fewer students are using alcohol. We also ask our students if they're currently using marijuana. That too has dropped, and pretty significantly since 2019, from 22% to 16% in 2021. So again, some of those things have significantly decreased, especially in this last year. We also asked students if they had seen other students being bullied at school, and we were happy again to see this come down. Fewer students are seeing others being bullied at school, down to 42% in 2021. We also asked students if they were bullied, and the next slide shows you, oops, back one, the percentage, I think, that's all right, of students who said they were bullied, and that has come down from, one more. There you go. That's all right. From 19% to 14% in 2021. So again, those are all high school students, but if you look at the next slide, we did see an increase in electronic bullying among our middle school students in the past year. We know that some of our middle school students probably had electronic devices for the first time around that time. So a little bit more electronic bullying among our middle school students, from 22% in 2019 to 28% in 2021. So that was the good news. I want to move to some of the things that are challenging, and they're challenging for all of us, and we all need to continue working on how we'll best support our students. Percentage of high school students who strongly agree that they feel good about themselves. And that has gradually decreased since 2011, and we had a significant decrease from 2019 to 2021, from 60% to 49% of students who don't feel good about themselves. We also asked them if they felt alone in their life, and that has increased. The percentage of students from 2019 to 2021 who say they feel alone in their life, so a lot of loneliness. And then this is a slide that tells us a lot, really. We asked students, these are high school students, if they were physically active for at least 60 minutes a day on 5 or more days before the survey, and that has declined. It's continued to decline since 2011, down to 34% this year. We countered that with the percentage of students who felt so sad or hopeless that they stopped doing their normal activities. In other words, it's the definition of depression that they read. And we've seen that significantly increase, so much that they've crossed each other. Generally, when students are more active, depression goes down too. So I don't know which one we attack first, but we certainly need to address both of those. And if we look at middle school students, the trend is moving in the exact same direction. The lines haven't crossed yet, but this is middle school data. We went from 30% to 35% in 2021, feeling sad and hopeless, and saw a significant decrease in physical activity during that time as well. And these are the suicidal behaviors, and we didn't go all the way back because we wanted you to be able to see the slide, but starting in 2015, if you look from 2019 to 2021, we again saw a small but important increase from the percentage of students who seriously considered attempting suicide. That's that blue line. The yellow line are students who made a plan for a suicide attempt during the past 12 months, and that increased from 15 to 18%. And then the green is the students who said they actually attempted suicide, and fortunately that stayed the same, but it's still moving in the wrong direction in terms of the trends. And what also hasn't changed is the number of gay, lesbian, bisexual students who are at least 3 times higher in each of those areas than their heterosexual peers. And this is a slide that I want to stop on for just a second and really look at this. It's something we started looking at this year. It's this percentage of students who seriously considered suicide, males and females. And if you look at 2011 for males, it was around 14%, and in 2021 it's still 14%. A little variation up and down, but still 14%. But if you look at females, in 2011, 15%, and that has doubled in 10 years' time. And so now those who are seriously attempting suicide among females has doubled since 2011. So this year we added another question to try to get at some of the information that we're also seeing come in from our DHHS partners around emergency room visits. And so we asked the percentage of high school students who did something to purposely hurt themselves without wanting to die. So not suicide attempts, but self-harm in some way. 22% of our students said that they had done that. That's greatest among gay, lesbian, bisexual students and our female students, which if you look at the previous data I presented, that would make sense. Another percentage that surprised us a bit, given the resources available to students, is the percentage of high school students who did not eat breakfast on any day during the last 7 days before the survey. At our high school level, that has increased from 19% to 24%. And then if you look at middle school, the same thing happened. And that increased from 12% to 19%. So we'll work with our partners in nutrition and think about, is it just about availability or is it also about education? How do we teach healthy choices and talk about the need for a good breakfast? And those are things that are important to this process as well. It's not just about availability, it's about teaching students how to make wise choices and healthy choices. So this is another question we've had for a while, and it's the percentage of high school students who strongly agree that their teachers really care about them and give them a lot of encouragement. And this decreased again this year. I will say to us, it's not incredibly surprising. It's been a hard year for teachers too. A lot of people in schools doing a lot, and COVID didn't just affect students. It affected their classroom teachers as well, who were expected to come and support them through the time. So, but it has gone down. But if you look at the next slide, that's the overall question. We asked students, is there an adult in your school that you can go to for support? And 60% of our students say there is. It might be a teacher, it might be a counselor, social worker, coach, janitor. It could be anybody that works in the school that helps them. And if you look at 12th graders, 69% said there was someone they could talk to. So as they get older and they build better relationships and they learn those relationship skills, they're also reaching out to significant adults in their school. So we've talked about this one for the last few years too, the percentage of high school students who did not go to school because they felt unsafe at school, on their way to school, or on the way from school. And this number increased again from 14% who didn't feel safe to 17% that didn't feel safe. I will say that one of the things that may have added in there this year, and we don't know that for sure, but this was the time when you could have felt unsafe at school because of COVID, possibly. So we don't know if that had any impact. We'll know in 2023 if that levels back out. But still, it's a concern. It's concerning that so many of our students don't feel safe. And this is a slide that probably I was most shocked by, this piece of data. This is a percentage of high school students who experience physical dating violence. And you can see that we started asking this in 2013, but from 2013 to 2019, it generally went down or stayed about the same. That line's considered level. And then suddenly this year, that almost doubled. And we'll be working with our partners in injury and violence prevention as well as our community partners to see what kind of educational interventions can we put in school to try to help support students' relationship skills, because that is a significant change. So if we look back and we say, what were the top concerns of our schools in the past year? Number one was mental health, counseling, social work, supports for our students. Number two was that safe school environment. And number three, student health services. And that had a lot to do with a lot of the resources that went around COVID testing. A lot more help. Some of the nurses were added to help with COVID testing. So a lot of more supports around health services during that time. And just a few of the things that we're trying to do programmatically to help to address some of this. The school-based mental health policy that was presented to you, I think in November, we brought those results to you. We've been working with our districts for a while now, trying to help build infrastructures for supporting students' mental health, having policies in place. Many of them already do, but making sure that's written down and that's in a consistent format for training and support suicide prevention protocols, those kinds of things. We also know that our Center for Safer Schools is working to provide resources around school safety, including safety grants. So many of them are using funds to not only address physical safety, but emotional health safety as well. And then many of our schools receive some funds for the ELC COVID testing from DHHS. Those were CDC funds that came through DHHS, and some of those this year will be used to address mental and emotional health concerns related to COVID. So many of our SHACs will be receiving some funding that they can use to help support students and staff as well. So I'll stop there for a second, asking any questions on this, specifically on the data before we.
Any questions at all?
I'd like to ask a question, please. That's great information. Do you have it broken down any by areas in the state or by counties that might say, you know, where I am, we may need to target one thing more so than another than someone else?
That's a good question. There were 19 LEAs that were oversampled and received data on their own, but they haven't received it yet because the CDC has not provided that data to us. And we did do regional oversamples, but we're not sure if we have weighted data for those. We had some difficulty getting the response level that we needed. So I will know soon, but I can't answer that question right now. We're waiting for the CDC to tell us how much of that data we have back.
Thank you.
But it's a good question.
Absolutely. So I oftentimes hate some of the data that's in this report, but I always appreciate that we get it. It's hugely important information. I was just wondering, with regard to the survey instrument, are there any questions included that deal with social media consumption? That feels like the natural next question for a lot of some of the trends I was seeing in terms of sense of loneliness, the digital bullying. I wondered, is there a way for us to assess as a risk factor how much social media that they're consuming? Because that feels like a natural next query.
I think there's a question on hours.
Yes.
Yeah.
Yes, sorry.
I'm sorry, this is Les Spell, our data and policy consultant, who knows the questions.
A little better.
Yeah,
So,
thanks.
yeah, we do ask questions about social media, and part of that is included in a screen time question. There used to be a question about how much time you spent watching TV, and then there was a separate question about computers and electronics. That's since been combined into a total screen time, and social media is included in that with TikTok, Instagram, Snapchat. That's all in the question.
Have you found any correlations? This may be in the report, so I apologize.
Any correlations between social media use or screen
Yeah,
time
screen
use?
time,
And I would have to go back and look at that individual. We have not broken that down to take a look at it in that manner. So we can get back to you.
But we
on-
can do that.
Great
Yeah,
question.
yeah, I'd be very
Happy to look
interested
at
in
that.
knowing that. And then the second one was just a comment. Just, am I to understand, based on this data, that 22% of all students have indicated they did something to purposely hurt themselves or without wanting to die, and that almost a full half of those students are gay, lesbian, or bisexual? Is that what this says?
You want to answer that correctly?
That's correct. Going back to that question. No, what that means, that's slide number 29.
Right.
So what that slide indicates is that of the gay, lesbian, or bisexual students that identify as gay, lesbian, or bisexual, 49% of that population of students have done something to hurt themselves without wanting to die. The 22% is the overall of all students. That would include all heterosexual students, GLB, other identifications is 22%. But the LGB population is at 49%.
So roughly half.
Yes, sir.
Half of the LGBTQ.
Of the LGBT,
That's right.
LGB students,
That's
excuse me.
extremely sobering. Thank you.
Any other questions before you proceed?
I do, just to follow up on your comment that that COVID might be part of the reason that students were feeling less safe. Are there some other areas here in terms of loneliness and that might also be reflecting the what life was like in 2021 for a lot of kids?
Possibly. I don't, we
But
have to
don't
be
we
careful to
do that?
speculate, but possibly. We did do the survey in the fall instead of the spring like we normally do because so many schools were out during COVID that the CDC, you have to be in school to do the survey. You can't do it at home. So we had to wait until the fall to do it, and some of those folks were coming back right out of COVID during that time. So there may have been. They may have been reflecting on their last year, which included some of that time when they were at home. So certainly we are excited's not the right word. We're anticipating and looking forward to getting the 2023 data when the time comes so we can see if that did play a role. We won't know until 2023. We won't have a better idea in 2023.
It just strikes me that that's in there, that's gotta be in there somewhere.
I would think so. I mean, some of those decreases, I would think, may have some contribution from COVID.
Mr. Duncan?
Thank you, Chair Keenan. I think we all agree, and have agreed to support how incredibly important this information is to get a better sense of what's going on with our student population. And if some of your comments, you mentioned some sampling shortage issues in terms of completeness of the data. And I know from being on the committee that we had a difficult time getting as much responsive information from as many areas as we would have liked in order to fill out the completeness of the survey to be very comfortable with the validity of the results. Could you address that for a minute so we can take this moment to encourage districts to participate in as full a manner as possible so we can get this valuable information, as was suggested by our state school board advisor, be able to use it locally in a way where you can make most meaningful usage of the information. I think we don't want to let this opportunity pass.
Sure. So we did oversample the 8 state board regions this past time. We always do the state level data. That's about 40 high schools and about 40 middle schools that are selected to get representative data. And they're selected by WestStat, which is a contractor for the CDC that randomly selects them. We don't make that selection. That's made by our contractor. But we select those schools, and this time we oversampled all of the 8 state board regions. But we had a low response rate, and a lot of times it was because the school district just said we don't want to participate, or they saw one thing on social media that was not accurate a lot of times and said they didn't want to participate. Our hope is that schools will give students and parents the opportunity to choose to participate. Because if you decline as a school district or a school, then nobody gets to make that decision for themselves. No parent, no student gets to make that decision. So we certainly would love to get more data. We would love to have regional data. I don't know if we will. I don't think we'll have all regions represented in our coming data. For a long time, we oversampled our whole child pilot districts, and several of them didn't participate this year either. And it's pretty valuable data. And if we can just give students and parents the opportunity to make the choice to participate, they can always say no. At any point, a student can opt out of the survey. At any point, a parent can say they don't want their child to participate in the survey. But what we found is that students like to tell us about themselves. And it is definitely aggregate data. We could never find out who a student is anywhere we are, the way it's done. So it's not identifiable data. It's an opportunity to really learn about what's happening. And what we had hoped by the regional data would be that we could compare what's going on in the West may not be the same as the problems in the East for our students. And we'd like to be able to address our prevention efforts and our intervention efforts in ways that make sense in those communities versus just doing something broad scale that doesn't necessarily address the needs in any particular community. So I hope that we'll get the opportunity. We are getting ready to start 2023 right now. We will not be oversampling the 8 state board regions this time, partly because the CDC is a little overwhelmed by such a big ask from us, but we will be doing some samples of some larger districts oversamples, and also be doing our state level data, and that will start in January as soon as we get our sample back. So hoping schools will participate if they're selected, and give parents and students that opportunity if they'd like. Thank you.
Superintendent, please.
Thank you, Chair. So I just wanted to comment on Dr. Ford's question about social media. It just so happens that yesterday in the Journal of American Medicine, Pediatrics, a study conducted at UNC Chapel Hill has shown that, their research is showing that all of the social media that students are consuming as their brains are developing is making them more sensitive when they're anticipating social rewards and punishments, and that it is making them unable to cope with feedback from their peers.
Interesting.
They're so hypersensitive. So this is coming out of their psychology and neuroscience department. And when I think about, I remember when Twitter came out when I was in the classroom. So first we have the advent of the smartphone, but then we have the real social media and the Twitter and the constant inputs that students are getting starting around 2011. And which is where we're looking at with your data, Dr. Essek. And then we see that, then we have this incredible isolation that we keep learning. I don't think we've learned everything that we're going to learn about the non-academic impacts of the pandemic on our students. So happy to get a hold of that JAMA article and send it around. I think it would probably be useful for us to familiarize ourselves with this data.
Absolutely. Thank you.
Thank you. Anyone has a question?
Thank you, Mr. Chairman. Dr. Essek, the slide that dealt with the young people who are considering self-mutilation.
Mm-hmm.
Could you go back to that a minute? Maybe I missed something. We talked about a particular group. What about the other children? Do you have any, is that on that slide?
Yeah, it's on that slide. So the overall, oh, no, back a little further.
Especially the cutters. We are seeing a lot of the cutters now, from the females.
So
Is that a part of that?
the other way, I think. No, I was wrong. I'm sorry. 29. There we go. Perfect. So the overall total was 22%. Males, 12% of the males said that they had done something to themselves. 31% of females. We can also get that by race and ethnicity if you'd like. We don't have that on that slide, but we can do that.
I would love to see that.
Sure.
Along with I was really attuned to the violence while dating
Uh-huh.
and that issue.
We were just looking at that before we came up here, trying to look at males versus females, because it wasn't just violence against females, so
Correct.
dating violence, so.
Correct.
Oh.
That would be interesting to know also. And this mental experience that the children are going through, it's gonna be tough.
Yeah.
It's gonna be tough. And these are, all kids are good kids. All kids are. But some, of course, see things entirely different. Social media, that you're talking about, and I know that's impacting it. There's just no doubt about it.
Oh, yeah,
I mean, they can do more with a telephone than the person who made it.
for sure,
Invented it, you know, once they get it in their hands. But anyway, thank you. I appreciate it.
certainly.
Go ahead.
Hey, all this data just is screaming to me the need for more school counselors and social workers and school psychiatrists and psychologists. Is our board doing anything to work on legislation that can make it so that we can have more of those in buildings? Because, like, I work at a school where we share all of those with multiple schools. It's just so obvious, and yet it's been obvious for years that we need more, but it never feels like we're getting more. You know?
I'll respond to that.
Thank you.
So in a few minutes, we'll be looking at our budget ask, and you'll see elements in there about increased funding for more psychologists and social workers, as well as requests for increased funding for increased pay for particularly social workers to increase. And others may, my colleagues may have other examples. I would say, just as one board member, we're just barely at the tip of the iceberg of what the need is, which is why it's so important to get these requests in and get them filled and get professionals hired and working with our teachers. You know it better than we do because you experience it every day as a teacher. So we're fully behind getting our students what they need so that they're healthy, and then you can teach them.
It would be amazing if, as a teacher, your teachers can focus on curriculum and instruction, and the people who are trained professionals can help our students with their mental health needs. And so I love that that's something we're working towards.
Yeah, really quickly, Dr. Isaac, could you maybe share with the board about the 2 grants
Yes, ma'am.
that we've just gotten? That might ease some minds.
So we did just find out, we just found out 3 days ago that we received 2 large federal Department of Ed grants that will allow us to work with institutes of higher ed, particularly HBCUs or those that are working with more minority students, to respecialize some of those personnel. So, for example, a school counselor, we would help pay for their tuition to become a school counselor, a regular counselor into a school counselor. We would help, some school districts have folks that are working provisionally. We would help provide tuition so they could go back and get their license, so they could actually be a licensed school counselor or a school social worker. So we're working right now. Some of that money will go directly to institutes of higher ed. Other money will go directly to some selected LEAs based on their need. And we'll be trying to provide more of that. That won't provide new positions. So I think that has to be in tandem with what Chairman Davis is talking about. It won't put positions in place, but it will help get the people available to go in those once we get them. So we're really excited. It was a little exciting. It was exciting. We didn't think it was going to come, and it came at the last hour, and we were really excited about that. So you'll hear more about that this afternoon, I think, actually.
It's a lot of money.
Thank you. Okay, let this go on to that.
Sure. So I'm going to shift a bit to what we're going to try to do from a policy perspective and update you on some of the work of your Interagency Advisory Committee, Whole Child NC. And to do that, I'm going to ask our School Health Partnership and Policies Consultant, Suzanne Schmall, who guides this work, to talk you through these next few slides.
Great. Good afternoon. It's great to be with you all and have this opportunity to share an update on the Whole Child NC Advisory Committee. And I see we have several of our members around the table and in the room with us, so thank you all for your engagement and commitment to this important work. So just as a reminder, the Whole Child NC Advisory Committee was established in 2015. It's been a bit on a hiatus. We've had a reboot, which we'll get to in a little bit. And the purpose of that committee is to identify the non-academic barriers to help our students, staff, and families in the school systems and communities, and make recommendations to the state board and other bodies as well. Great, thank you. So we were fortunate to have an opportunity this past May of 2022 to engage with the Education Commission of the states, and there was a policy academy, and this was a great opportunity for an interagency collaboration between Department of Health and Human Services, DPI, as well as the Office of the Governor. And several of us went to Colorado to participate in this academy, which then allowed us to align our efforts with Whole Child NC Advisory Committee and kind of re-envision this reboot and this important work. And we, as part of that, developed a shared vision, which we'll share in a little bit, and continued planning for upcoming work, as well as some additional opportunities, which I'll mention in just a second. So thank you. And that vision you see here was developed at the Policy Academy, and it says state agencies will coordinate so that all children thrive in a nurturing environment and have the resources and supports they need, provided the way they need them and when they need them. And we know that this is very global in general, and the advisory committee is currently working on adapting that, revising it, making sure it is inclusive and represents the work that we want this body to represent. So again, that's a very global statement, and we recognize that, and it's very aspirational, and that's the intent. And you see a picture there of some of the committee members who were at our first meeting, or second meeting actually, in November. We have to date have met with members in September and November, confirmed 2- and 3-year term commitments with those members. There are several that we're still working on identifying and confirming their commitment as well. There are many representatives within that policy, but I won't outline necessarily here today, but if you have questions about who's on that, feel free to let us know. It's about an 18-member committee, and again, we've reached out to the committee who is part of that group to help us identify others who maybe are missing from that table and who else should be at that table. So we're continuing to make outreach and confirm those members as we speak. We have also sought input to, like I mentioned earlier, about the vision, and we have begun just in those 2 meetings to already generate and brainstorm a list of policy and priority recommendations that we can continue to outline and focus on and make those recommendations by this coming June. So we have a lot of work to do in a little bit of time, but we are excited and committed. And also just want to share that we were invited by the Education Commission of the states to go just this past November to share about this work and to share with other state members across the country and the engagement, as they've been very engaged in this work alongside with us and helping to facilitate those meetings so that we, especially those of us at DPI, can kind of be more engaged in that work and not necessarily having to facilitate it, which has been a great opportunity. Upcoming steps for Whole Child NC are to develop those bylaws, thanks to the other committees that are part of the State Board of Education who are helping us with that, confirm the chair and vice chair, plan for our continuing meetings in 2023, reached out to those proposed new members, and modify the policy, again, go back before and modifying that policy to reflect those new members. And then, again, make those recommendations of June of 2023. I think that's it. I think that's it. And what I'm really excited about, and our team's really excited about, is to bring forward the team from Anson County Schools. They have done a lot of amazing work, as a lot of districts have, but they have a fabulous team who has done a lot with the resources, the partnerships, and initiatives in their community to address the challenges and build on those successes. Their superintendent, Dr. Howard McLean, is not able to be here with us today, but Dr. Mary Ratliff, who is the administrator for Student and Administrative Services, is here with us, with her amazing team as well, which includes yeah, please go ahead and join us, Dr. Mary Ratliff, which includes Cam McDonald, who is their lead social worker, school social worker, along with Mary Kay Woods, who is their lead school nurse, and then Gwendolyn Coker, who is their school-based mental health counselor. So they're going to come up here and share with you an overview of Anson County Schools and some of the work that they're doing to address a lot of the challenges that have been mentioned. So thank you very much.
Good afternoon.
Good afternoon.
My name is Dr. Mary Ratliff, and I am the Administrator of Student and Administrative Services for Anson County Schools. Our district is very excited and honored to present with today and to inform you of some of the things that we've been doing as a SHAC. Well, when I first told everybody about SHAC, they wanted to know what in the world is a SHAC. And so I said it's School Health Advisory Council. And I can tell you my very first year on the job, it was a learning curve for me. I didn't realize that SHAC encompasses so much. Our superintendent, Mr. Harold McLean, could not be here today, but I can tell you he is a champion for children. He is very supportive of the work we do as a SHAC. I want to focus on the work that the SHAC does, but before I do, I would like to say that this is a total team effort. It's the community, parents, teachers, it's everybody. It's not just the members of the SHAC, it's the invisible members that you don't see. So here today, we have parts of our team that I call them the voices from the field. They're the boots on the ground. They're the ones in the schools, seeing students every day and making impacts every day. So Cam McDonald is our lead social worker. Mary Kay Woods is our lead school nurse. And Gwen Coker is our lead school-based mental health counselor. When you think about the whole community, whole school, and the whole child, you look at connecting the mind. The mind, because it's what we know we should be doing. The heart, because it's how we feel about what we're doing. And the hands, because that's the work that we do. So you have to connect what you know with how you feel, and then put the work in. So an overview of Anson County Schools. As you can see on the screen, based on the 2018 census data, our population is roughly 25,000. Currently, our district has a little over 3,000 students. Our county residents have a median household income of $29,000, and 31.5% of our residents graduate from high school. And so when you look at that data, it looks a little gloomy. But Anson County has a secret superpower. And that superpower is a caring community. So at this time, I will turn it over to Ms. McDonald.
Thank you, Dr. Ratliff. Good afternoon. My name is Cam A. McDonald. I serve as the lead school social worker for Anson County School District. I do appreciate the opportunity to be here to speak with you, but also that you know who we are and you are aware of what school social worker needs are. In 2020, a community health assessment was performed in Anson County. Our county stakeholders thought of what they thought were the big key issues. So the top three was poverty, children in poverty, and low pay of available jobs, which drives the poverty. So when looking at that, we also saw that we have 41 students right now in our district who are experiencing homelessness that have been identified under McKinney-Vento. We have a decrease in access to health care due to the loss of a primary care provider, and also we lost 4 mental health and substance abuse treatment providers. So we are looking at these things and finding resources to decrease and eliminate the barriers to socioeconomic things that families need in our district. Next slide. I'll turn it over to Ms. Coker.
Thank you. Again, I'm Gwendolyn Coker. I'm the lead school-based mental health counselor for Anson County Schools. And just as Mrs. McDonald mentioned, our community had a couple of issues that we needed to address. In terms of mental health, our school participated in the youth risk behavior survey that was previously discussed. And even though a good amount of our students were not at risk, we still had a large amount of students who were. 24% of our female student population considered attempting suicide, and 21% of our male population considered attempting suicide. And those numbers are very alarming. So at that point, we was like, okay, we gotta kick it into high gear. And so we partnered up with Sand Hills Mental Health Agency, and with their collaboration, we were able to bring on 2 clinical mental health counselors, myself being one of them, to serve our school district. We also were able to bring on 2 parent liaisons to assist us in providing intensive support. Even though we have a great team and we're making do with the resources that we have, there is still a great need for additional counselors. In regard to our program and what that kind of looks like, I'll discuss that a little bit more further on. So I promise I'll get back to that.
How Anson County Schools has responded to the barriers that our families experience. We use our school health advisory councils. I know y'all think we are overloading y'all with Shack, but the Shack does a lot of great work in our state and in our county. And so our school health advisory council uses our Shack to implement plans, to look at problems, to find out what's the greatest problems, and to create a plan of success to overcome those problems and find resources and inputs and partnerships to help us help our families. Our Shack consists of local school support personnel. We're happy to say that we do have services at each of our schools in the term of social work services, counseling services, and school nurse services. So we're a part of that team along with our local DSS, health department, the Partnership for Children, 4-H&D Extension Office. Those are some of our partners that help us create plans for our students. We use grant funding to put things in place for our children so that they can receive education, so that there's things that can help them with the things that hold them back from being in school every day, and other community initiatives. We have personal hygiene bins in all schools so that any student or family who has a need, male or female, we have something available that they can take or that they can use and a way to help them with whatever they need. That goes from using deodorant to feminine hygiene products to washing clothes if needed. We have maintained food pantries at each school. I'm excited that our nutrition director got a grant, and so now at every school we not only get free lunch and breakfast, which we really need, but we also have pantries at every school. So if a student is hungry, we have extra for them. They don't have to sneak and get it. We have it for them. We have families. If the parents call and say, we need fresh food, produce, or meat to make meals, we can get that to them. They have access to that through this grant. We're so proud to have that grant because it's really helping our parents. We have a student-led hydro farm, so our high school students are doing some great things. They have a hydroponics farm, and they grow lettuce there. The lettuce actually ends up in our school cafeteria for our lunches and also at local restaurants, and people are buying it. So we're really proud. That's a picture of some of the work our students are doing to make it work. We also have our school-based mental health program, which you'll hear about from Ms. Coker later. We have a partnership with the Second Harvest Food Bank. They're out of Charlotte, but Anson County always wins an award every year for bringing in the most pounds of food. It's over thousands and thousands, but we're bringing in the food to help our families because there is a great need. Our county lacks infrastructure for internet. We are a food desert in most places in our county, and so it's a big help in helping us get things out to families that they need. The lead school social worker and the lead school nurse were featured in a COVID documentary that highlighted district and personal effects of how we influence healthiness during the pandemic. We use the Friendly Dental Van. They come to help students who can't get to a dentist or don't have funds to get dental work done, and they do follow-ups for those children. We also have a partnership with Prevent Blindness, so if someone needs glasses or lost them or broke them and they have no more funds, we help get those glasses because it's going to increase their vision. We have Title V. It's helped us a lot. We have used Title V for professional development, not only for staff, but also for our students. I brought several loads of my children here to Raleigh, to the Alice A. Cobb Post Center, to get puberty and nutrition and other health information, and they love it. Because not only were they exposed to coming to Raleigh, a place they'd never been or seen, they just love looking at those buildings, but they got some education that the parents wanted them to have, and they thought it was fun. So as for the staff, we are using trauma-informed care, self-care, and social-emotional learning. So staff have been utilizing the social workers, the counselors, the mental health counselors more during this time because we are people, and during this pandemic, we've all needed something with mental health. So we've been available to our staff and families as well. Through trauma-informed care, we took a course, and most of the support staff took it, as well as a few administrators, and it was called Piece by Piece, but it talked about student abuse. We took another course on suicide assist training. My whole school is trained in suicide assist, and I'm very happy about having a grant that allowed us to get that training. We also took a course at 2 schools, mine included, on Darkness to Light. It taught to our staff members about sexual abuse, how to look at the signs, what to know, and how to make reports. It was very touching and endearing to the staff because they opened their eyes to look at ways we can be safer than we are. We also do social emotional learning. Everybody's doing it, every classroom, every staff member. We're doing what we can to keep our kids healthy and happy and be connected to them. Ms. Woods.
Good afternoon. I'm Mary Kay Woods. I'm the lead school nurse for Anson County Schools. And I'm going to talk with you about the physical activity, the physical education that we have, the activities that we do, the fun stuff, which we all know that healthier kids, they do learn better. It affects them not only emotionally, physically, but it's just a good overall sense of well-being. An important component of our student wellness program is to promote lifelong the love of physical activity and exercise. If we can get the kids young, then that will go with them as they age. Elementary school, we have the 30 minutes, the 3 to 5 times a week, that we have that. But we can get it to the middle school when it starts their time in school lessons, but they can do it on their own. So we want to get that while they're young, so they will be lifelong lovers of physical activity and fitness. And if you'll notice here, we have some conditions, health determinants like anxiety, heart disease, stroke, and other illnesses. Exercise makes a world of difference in that, educating the children and the families about why we need to exercise, why we need to move more and stay off of the phones, which we've had a lot of conversation about that, but we want them to move more. And the next bullet says, Healthy Active Anson. We did something really cool. We brought our families in. We met at our gyms. We had local parks. We had safe places. Some schools, we did an outside track with the families. But what we did was we brought in our children and their families to walk in a safe place to promote that wellness, that physical education and wellness. And it was kind of cool because the kids did get an incentive for doing that, but something kind of magical happened. Sometimes in the school system we kind of lose parents along the way. Well, the kids really taught this stuff up at home and got the parents to come in. And it's about the R word. I know education, they like to say the R word's rigor, but in our social and support, we like to say relationships. That relationship piece is huge. So we were able to build relationships with families that way, and we continue to do that. That's just really important to us, is building relationships. You can flip next slide. Okay, this is a cool slide here. We mentioned the telehealth. If you will see the first, you see Atrium Health. We have telehealth. We are a pilot school. We have 4 schools who are piloted this year. It's really cool because what happens is, with parental consent, we have a pediatrician like in a kiosk, and we have a med tech that comes to the school, plus our nurses there, because we do not want to put a child in a room with 2 strangers, one on the computer and then one in person. So that R word again, that relationship. We place our nurse in the same room with them, so the pediatrician can assess the child through these cool probes, like they can listen to their heart, their lungs, they can look at their nose, eyes, ears, and the pediatrician on the other side can diagnose that child.
like I said, with parental consent. And the parent can also Skype in, be on the phone, whatever. They can actually be there virtually for that visit. And then what happens next, if the child needs any prescriptions, that physician can just send those to the pharmacy of choice. And the parent can get those at their convenience. If the child can stay at school, that's great. If they need to go home, then they have to go home. But it keeps students and also staff in school, less absenteeism. So it's just really a cool program. And like I said, my hope is for it to keep expanding out. You know, we always want more. So it's in 4 schools. I want to see go more. So really excited about that. And that is with Atrium Healthcare. That's our partner. And also below that, you're going to see Anson County Health Department. We've always had a strong relationship with our health department, but during the COVID pandemic, we became really tight, and that relationship has held up. It's been cemented, and I can't say enough good things about our health department and how they work with us. They provide vaccinations for our children and immunizations and lots of education. If we need it. I can call them right now and say, hey, I'm in Raleigh. I need to know this piece of information. Can you get it for me? And they're going to try their best to get it for me. It's a great relationship. And you see parents. Parents are our greatest asset. They help us so much. We have local businesses who support us. We have faith-based communities. And like I said, there's many more. But if you notice, you see there's a football player there. Cam Newton there, I think number 1 there. You have Walmart, and you've got the hospital. Our local hospital is Atrium Anson. They partner with us through the 5210 program, which is the 5, fruits and vegetables each day. You want to get the kids moving 2 hours, a day, 1 hour of the screen time, less screen time, and then 0 sugary drinks. But the whole point is to get them moving more. And let's see, am I missing anything on that one? No, faith-based. This happened last night. We were prepping for it today. Got a message from a family in the community, and they said, Mary Kay, I hear you guys need some supplies. And I said, well, great, that's awesome. And so they want to know what they could do. So like Dr. Ratliff said, we're small, our resources are limited, but our community has a huge heart. They want to help us. They're there to help us when we need it, and they're there to help us when we celebrate. So you can go to the next slide, I think. Okay, so here's the telehealth data. Okay, the top 5 diagnoses, and these are not exclusive, but these are the ones we have seen since we started. And of course, the first one's going to be upper respiratory infection, and then you've got your sinusitis, you've got your pharyngitis is the blue. We're going to go clockwise. So you have your upper respiratory is your top, you have your pharyngitis is the blue at the bottom, where the 6 o'clock would be, and you've got sinusitis, vision, eye problems, and cold and flu. And they can swab you for COVID, flu, strep. They can do all that stuff. So it's really cool. I was at the nursing conference the 1st of December, and it was actually an administrator there, and he said that his child went to see the telehealth pediatrician, and they were speaking high about it too. So we're just really excited about it and really pumped about it, and I want to see it expand into more. And we saw, actually, if you'll flip back one more time, here's the total number of visits we have seen thus far is 196 in the bottom of the right. You'll see so far, and that's just from when we started school at the end of August to now before Christmas. So that's pretty good. So, Artie.